I will start answering questions with Ron.
Thank you very much, Eileen. This is Ron here, and thanks to everybody for calling in for your questions. I think we're pretty much caught up on the typed questions, and so we've been able to keep up with that today.
So, all right, so there's a question on the Gleason scores, so we can just go back to that slide. When you're asking for the primary biopsy Gleason score and the secondary biopsy Gleason score, are you referring to the primary and secondary pattern? And then there's the example for primary would be 4 and secondary would be 3. So the score is the combination of the primary and secondary. And the answer is yes, both the score and pattern are used and meant to describe the same thing. So in this case, the primary biopsy Gleason score is 4 and the secondary biopsy Gleason score is 3. So if you've gone through all the pathology reports on the patients, the pathologist only documented right or left lobe and Gleason score and amount of tissue is involved. If you're not able to find the number of cores positive and the number of cores examined, you should enter the missing data for this. So for recurrence type, we can go back to this recurrence question. So what level of PSA should be used to classify a patient as having a recurrence? We're not asking registrars to interpret PSA results. Please record recurrence if clinical notes indicate recurrence and or if patient receives treatment for recurrence. Does the patient have the recurrence if he was never disease-free after treatment? Please record the date, the first PSA test after primary treatment as a date of recurrence. So local recurrence is defined in the manual and only record local recurrence if the defined criteria are met. So if you have not received the instructions documents, everything can still be found online, including the instructions form. The electronic version of the instructions is the exact same information that what was mailed out. So if you're able to access the online copy, it's identical to the physical copy.
Hey, Eileen, this is Ron. There is a question about where people can find the slides from these webinars. Maybe you can sort of show that slide very quickly so then people can know where to go to find these talks.
So I went back to the study communication slide, which is on our website, and we also post them on the Cancer Forum under the Standards Resource Library. So if people want to just copy down this website, I put the slide up now. So
I'm sorry, Eileen. So there is a question that I think it's probably easier to address verbally. The question is, so what we talked about on the forum today is that we are not asking the registrars to use PSAs, or we're not asking you to interpret the PSAs to define recurrence. And so we're asking you to please, if a physician in the note, in a clinical note says there's a recurrence, or if the patient has received treatment, additional treatment because of recurrence, please use those to indicate that a patient has recurrence. On the other hand, we have also given an additional caveat to that, which is there is a group of patients who perhaps were never disease-free, and so they just finished their surgery, and the first time after surgery they had a PSA checked, and they were never disease-free. And so somebody did ask that question, and so for this very specific indication where the patient was never disease-free after primary treatment, we have further defined this for you to please use the first PSA date for scoring the recurrence for these patients. I hope that's clear. Only for patients who were never disease-free after treatment, then please use the first date of PSA to define the recurrence for these patients. Thank you.
So there's a question about if you're able to sort the PSAs on the web form. Unfortunately, the web form is unable to do this. If you enter the same PSA more than once, the data analysis in the future can take care of this, and you won't have to worry about going back and deleting it. The slides will be available to review, and we will post the recorded webinar and the slides on the website. So if you have requests out to the PCP and the urology and other physicians, the office is considering complying with the request, and they will contact after this discussion with physicians. Unfortunately, because the urologists often check PSAs, and this is critically important information for the special study, if you're not able to get data from the urologist, then the patient is not eligible. So if a patient expires after one PSA within 1 year of surgery, is he eligible? Yes, the patient would still be eligible if you had all the records and from all the providers. For radiation treatment planning and post-brachytherapy scans, do you want these collected, and what do you want entered for the indication?
So Eileen, if I can chime in here. The registrar's question is exactly correct. There are some patients after brachytherapy who will get a 1-month CT scan to basically look to see that the seeds look okay in the prostate. And so this question was asked a couple of times because I had to go back and forth with the registrar a little bit to clarify the question. But the ultimate answer to this question is if the patient gets a 1-month CT scan after brachytherapy, the reason for the scan should be coded as other.
Thanks. So you are required to submit 12 patients that are eligible. So 12 total patients per site. There's another question on the NPI. So if if you cannot find the NPI on a physician or it's unknown, then we ask you to enter the 0s, 9s, and 7s option that is stated here.
So there is a question that I am in the process of answering now. And the question is, can you please review the case selection or eligibility process? So there are 3 screening questions for eligibility, and that is on the web form and also in the printed instruction manual. But basically, a patient is eligible if they meet these 3 criteria, and there's no other criteria. And so, if a patient, if there's evidence that there's medical records available for 5 years, or distant recurrence or death, whichever is first, if the patient meets that criterion, and you have records from urologists in primary care, and the patient had at least 1 PSA within 2 years, any patient who meets these 3 criteria is considered eligible. We get lots of questions of different scenarios where a patient may not meet these 3 eligibility criteria, and if they don't meet these, then they would not be eligible.
And I've also posted the eligibility criteria on the slide. So there's a question on they didn't see a place to indicate a recurrence was considered biochemical. How would one code a biochemical recurrence? There's a date for first recurrence of any type, which includes biochemical recurrence. We are not asking separate questions to specifically document biochemical recurrence.
Eileen, there is a question that says, in terms of the slides that from the webinars, that this registrar is not able to find the slides, but only recording of the slides. Do you know if the actual slides are posted as well?
Yes. I might be able to pull it up right now. So this is our study website, and under here, under webinars, this left link is the recording, and then the PowerPoint is right next to it. So the PowerPoint slides are on the right, and then the recording is on the left. And so if anyone has any more questions about the website, I can go through that too. This is where we post all of the letters for outside providers. Here we have the electronic versions of the instructions. These are the certificates for the webinars, but so far all webinars have only been 1 credit. And today's webinar number 4 that we should get posted today, and we also have all the NCRA numbers listed here. So all of the recordings are on the left and the slides are on the right. And we've also posted all of the email announcements that have gone out with the dates. So if you haven't been receiving the emails, every single email is right here.
Eileen, I've seen about 3 questions of registrars saying that they had emailed us requesting original cases be reinstated, but they have not heard back. And so maybe after this call, we can look into this issue. I think that's a very important issue.
We do have the capabilities to put the patients back on your list. So we have had a lot of requests for this, and we have to do this manually in our technical department. So we're not ignoring you. We will respond. It just might take longer than 24 hours to do that, but we should be getting these done quickly now.
There is a question here that if a patient was diagnosed with distant metastasis at the time of diagnosis, what to do about a patient like this. So that would be an error. And so if we are only including patients who do not have distant metastasis at diagnosis, so if indeed some of the selected patients have distant metastasis at diagnosis, and probably their initial staging was incorrect and in the NCDB, and these patients who already have metastatic disease at the time of diagnosis, these patients should not be included in the study.
So the deadline for the study is July 24th, 2017. It was previously July 17th, and we have extended it by 1 week. So for prostatectomy, there's a question on the web form for tertiary score. Please look at the pathology report to see if this information is reported. Sometimes it is in the prostatectomy pathology report, and sometimes it is not reported. So we only want you to enter it if it's in the report. So we want you to update the most current information into the NCDB field. So if the information of the prior information was incorrect, we want you to update it to the correct information.
There has been a couple of questions about local recurrence. And since there's been a couple of questions, I wanted to address this for the whole group. Local recurrence, I think in the manual, is defined pretty precisely. It's either based on the biopsy or, and I don't have the manual in front of me, but or based on the scan that shows a local recurrence. So to be able to record a patient as having a local recurrence, they have to meet the definition in the manual. A patient who just has PSA rise or whatever, and the physician says they have a recurrence, that is not necessarily local recurrence. The local recurrence is defined pretty clearly in the manual.
So local recurrence is defined as recurrence in the prostate or prostate bed in the manual. And this is defined by biopsy of the prostate or prostate bed and pathology from this biopsy showing the recurrent prostate cancer. So the date of the local recurrence would be the date of this biopsy. If a biopsy is not done or information is not available, local recurrence in the prostate or prostate bed can be defined using imaging. So the date of the local recurrence would be the date of the imaging scan. So the bottom line for these eligibility questions is if you're unable to obtain the PSA data, then the patient is ineligible. It's okay to have no scans on a patient. You need 5 consecutive years of complete PSA information, but some patients may not have PSAs every year. If you're having problems receiving the whole chart, then you can just ask for the information that you need that is related to prostate cancer.
Yeah, so I think somebody raised a very good point, and I want to address that. And the question or the comment is, it's important to note that if a patient's PSA level remains near 0, we should not expect to find much imaging studies on these patients. So I want to clarify that we are asking that you all help us collect data that's on these web forms. But it is the general concept that it is absolutely true that some patients may not have a lot of imaging, and some patients may not have a lot of biopsies, and some patients may have a lot of PSA, and some patients may not have any PSAs or very few PSAs. That is absolutely true, and so just because there is variation in practice, and we're going to use that variation to see if people who get more imaging have a better outcome, more PSAs have a better outcome, and people who have fewer imaging or fewer PSAs to see if their ultimate survival outcomes are different. So absolutely, I think the registrar is correct. Some patients may have very few tests, and that is what we expect to see.
So for the scans questions, if you document all CT scans, X-rays, and other scans that the patient has, that was how the original study was designed, but we have received some pushback from some registrars who had to enter so many different scans for some patients. So we have modified the instructions to be that we only want the scans related to prostate cancer. However, if you have already entered the other scans, we will gladly accept them, and they will be very beneficial to the data collection. But if it's a lot of work on your part, then we only want the prostate cancer scan. So these cases were selected through the NCDB. We had a back-end eligibility criteria for a case to be eligible on our end, and then there's also the 3 eligibility questions that you have to answer. So there could be many reasons if a site doesn't have patients on their list. Part of it could be a reference date is after 2009, among other options. So if you have the first 2 years of PSA after the surveillance date but do not have every year of PSA, that is the patient still eligible. So number 1, we need the patient to have 5 years of complete information on PSA. But number 2, it is quite possible that the patient did not have a PSA checked every year and they would be eligible. The data collection instructions are on the website. And I think we already went through that. In the recurrence section, we ask you to enter radiation treatment for metastasis. So an example of a tertiary Gleason score would be some patients have a Gleason of 3+4, which is tertiary 5 on the pathology report, and this is what we're trying to capture. So the primary would be 3, secondary would be 4, and tertiary noted as 5. And that's what information we're trying to capture. So if the patient was never disease-free and you use the next PSA as the recurrence, would you consider this a local recurrence? We answered that. But yes, we are considering never disease-free as having a recurrence.
Eileen, there's a question that is asking about additional clinical information page not working. Did you talk about that in one of your slides, and can you revisit that issue?
Yes. So some registrars were having issues with the display of the additional clinical information tab. We have resolved it as of yesterday. So if you're still having problems, send us an email. But that should be completely fixed by now. So. So if a patient's PSA level remains near 0, CTR should not expect to find much imaging studies on these patients, as there's no or very little risk of recurrence. if you do not have 12 patients that are eligible for the study, you are still required to participate, but if you have less than 12, we still want all the eligible patients that you have. Some patients may not have a PSA checked every year, and that is okay. So the system will prompt you to correct the errors before you submit if there's something wrong. We have built that into the web form to catch as much errors as possible. So this is a good question. So once you enter no for the first question, you're not able to see the next question. That is how the web form is designed. So all 3 questions have to be answered yes for a patient to be eligible. So you will not see the second question if the first one is marked no, and you won't see the third question if the first 2 are marked, if any of the first 2 are marked no. So you have to say yes, and then on the first one, and then you'll see the second question, and then those 2 have to be yes before you see the third question.
Eileen, just to answer a question here, can you show again where to find the PowerPoint slides for the webinars?
Sure. So here's the website. So it's under Quality Programs, Cancer, American College of Surgeons Clinical Research Program, and then Special Study. So we have Prostate Special Study right here. And then we have webinars. We have them listed here. So these are the previous webinars. So webinar 1, and then the PowerPoint slides are right next to it. So there's 2 separate links down here. So So if you're unable to get follow-up scans for 5 years, that question depends on if the patient had scans that you don't have access to, or if the patient did not get the scans within 5 years. So let's go back to that slide. So you just need all the scans related to prostate cancer. Yes, so when we say all webinars have been 1 credit, that means 1 credit per webinar. So 4 credits total if you have attended all the webinars or reviewed them previously. If you have less than 12 eligible patients, we would like you to submit all of the eligible patients that you have.
Eileen, there's a couple of questions where the registrar is not able to see the special study web link. Maybe part of it is cut off on their screen or something, and the web address is pretty long. Maybe after this webinar, we can just send an announcement to everybody with these links, so then everybody has it in their email and they can refer that to that easier.
The link has been in every email that we've sent out. So if you're receiving the emails, the link to the website is in all the emails. And if you're not receiving the emails, then please email us and check with your IT department to put us on the whitelist.
And our email is specialstudy, one word, specialstudy, at facs.org. So it should be pretty easy to remember.
But we have been sending emails with the link to the website. So someone shared a tip that they found it very helpful to create a simple little Excel spreadsheet right from the start to keep track of the cases that the ones that would be eligible versus the ones that would be eliminated, and makes it easier to compare your own list with the list from the web form. So if your hospital doesn't have 12 eligible patients, does that mean that the hospital is not eligible to participate in the study? Well, if you don't have any patients, then that would be correct. But if you have less than 12, so any number between 1 through 11, we still want those patients. So even if you have less than 12 eligible patients, we still want all the patients that you have. So if you have the scans in your system, but you can't always see the results, please see if the physician notes say anything about those results and see if there are paper radiology reports you can obtain. There's also options to enter unknown results on the web form. So as long as the MD note says a recurrence, that would be the first date of recurrence. And if they do not, and the patient receives treatment for recurrence, then you would also document that as recurrence. So we are not asking the registrar to interpret PSA results. Please report a recurrence if a MD note says recurrence or if a patient receives treatment for recurrence. The list of patients currently displayed is the final list.
So I think this is asking, I think we had previously a glitch where there was an initial patient list, and I think that disappeared, replaced by a new list. I think we've been trying to correct that. But if you have not started the process, I think, and I assume that's what's underlying this particular question, I think the answer is yes. We do not hope to have another computer glitch to erase the patient list. And so the current list that you see should be the final list.
The concept of a biochemical recurrence is unique to prostate. I think that's all the time we have for today. Is there anything that anyone else would like to go over? I guess the main thing about the NCDB data is that we want the most current information. So that's all we have for today. So we will talk to you next week. Thanks for calling in.
Thank you very much.